Hi, I'm Brett Cohen. I'm one of the weight loss surgeons here in the Memorial Bariatric Program, and I want to talk to you a little bit today about our weight loss surgery program. The surgery is a little bit different than other operations that happen in the hospital, and it's a formal commitment from the hospital to a weight loss surgery program. It goes to speak to specialized equipment in the operating room for patients that are overweight, specialized equipment in the radiology department, nursing staff that is trained and continually trained on taking care of weight loss surgery patients. And as a matter of fact, the American Society of Metabolic and Bariatric Surgeons, that's our governing body, started awarding a center of excellence in weight loss surgery, looking at how many operations you do, how few are your complications, and how well do your patients lose weight, and awarding a center of excellence. And Memorial Regional Hospital with our program was awarded a center of excellence within the first couple of years of conception of the program, and that's quite an honor for the hospital. The Memorial Bariatric Program, we operate both at Memorial Regional Hospital, which is on the east side on Johnson Street, and Memorial Pembroke Hospital, which is on Sheridan and University. The surgeons involved in the Memorial Bariatric Program, we've actually taken at least a year, if not more, within our training to learn how to do these operations and take care of patients that have had these operations. So we do a lot of this, and we do it very well, and I think our results, our outcomes, and our successes really speak for themselves. When you look at weight loss surgery, it's not just about the operations that we do. There are other aspects to it, and those things help people have good success. So one of the first components was the dietary component. We have a group of dietitians within our program that are specifically trained in bariatric surgery, how to take patients from where they are now, teaching them what they're doing wrong, what it's going to look like after the operation, and what to expect after any one of these operations.
To cleanse my body, I saw the nutritionist who put me on the right track to lose weight before the surgery. I just followed the bariatric diet, the book that comes with it, and I lost the weight.
This is a very, very important part of our program. We're going to look at your diets now, figure out what it is that you're doing wrong, help you to figure out how to go out and shop after operations, how to go out to dinner with your friends and your family, and how to make this work on a real-time level for you as an individual. Now, we also have the dietitians meet with you in the hospital at the time of the surgery, and then there's regularly scheduled follow-up with the dietitians afterward. We have various support groups and education classes that go along with getting ready for surgery and helping to support after surgery.
Before I ever had the actual surgery, after the seminar, you had the option to go to different classes that they had, because you saw a nutritionist, which helps you get you prepared, let you understand what you're going through.
I did go to their support groups every single month for the course of 6 or 7 months while I was waiting to have my surgery, and it was a great opportunity to meet other patients who had had surgeries and to really firsthand hear exactly how the surgery went, how the recovery was, tips on different foods, different protein sources, and to be a constant source of support before and now after the surgery. So I still go once a month to support groups, and I meet other people that have had weight loss surgery and to hear their story, and maybe I can offer some advice to them and vice versa.
Everybody that goes through the program gets a psychological evaluation. We think that this is an important part of what we do, looking at the reason why people eat the way that they do and how are we going to fix that after surgery.
You go to a psychologist so you know within in yourself what choice that you're making. You understand that it's a lifelong choice that you're making. I'm going to do this for the rest of my life.
It's not just about the dietary changes. We talk always about exercise that goes along with it. As a matter of fact, I don't care what you do. If you want to walk or bike or jog, you want to swim, you want to go to the gym, you want to do aerobics, you want to do sports on the weekends, any form of regular activity is perfect. Now, as part of the Memorial system, we do have the advantage of having the Memorial Gym. And Memorial has a gym near the Memorial Regional Hospital on the east side and also one on the west side. And we do have some exercise physiologists that'll set up a program for you, and you can take advantage, starting from the beginning of just setting up a program that you do on your own or meeting with them once a week to help you get through that program. And as part of our program, we can give a bit of an incentive, and having the gym membership for the first 3 months without a charge at all. And beyond that, if you like it and you want to continue, we can get you a discounted rate as if you were an employee as part of the Memorial system. So it makes it very, very affordable. There are 3 main operations for weight loss surgery: a gastric bypass, a sleeve gastrectomy, and a band. And a band can be done in 2 different ways. So the first operation I'm going to talk about is a gastric bypass, and that's kind of the gold standard operation. It's been around for a very long time, changed a little bit over time, became very popular in the mid-1990s when we started doing them laparoscopically with little tiny incisions. So a gastric bypass is an operation where we create a significant amount of restriction, and we also add a little bit of malabsorption. And essentially what we do is we cut a small pouch out of the stomach and exclude it from the rest of the stomach. And that pouch, everybody describes a little bit differently, but we say it's somewhere around 1 ounce to 2 ounces in size, a golf ball or a peach, a plum, but a small pouch that excludes the rest of the stomach. We reroute the intestinal tract, we bring a loop of the intestine up to the pouch and connect it to the pouch so that food travels into the pouch and then down the intestinal limb, missing the rest of the stomach and the first part of the small intestine. And that bypass segment creates a little bit of what we call malabsorption. And the easiest way to think about that is a little bit of the calories that we're taking in really aren't picked up. And so this really helps augment or make the weight loss come a little bit quicker and a little bit easier.
When I decided to do the procedure, my weight was 292. I lost about 85 pounds since November 6th of last year.
So as you eat, you fill that very, very tiny pouch. A very small amount of food is going to make you feel comfortable, and you don't need to eat any more.
I'm very satisfied when I eat because I fill up quick. Even though I'm eating less, I still have a lot of energy, more energy than before.
Now there's another component to a bypass that we talk about as well, and that's a hormonal change. And we're not talking about the estrogen and testosterone type hormones, we're talking about the hormones that drive your hunger. And we call them leptin or ghrelin, these different hormones that make us feel the desire to eat. And a great advantage of this operation is that those hormones, they go down and they stay down for a prolonged time. And that may be as much as 6 months, a year, and in some patients as many as 2 years. So that desire to eat just isn't there, and that's certainly helpful when you're trying to lose weight.
Now I watch what I eat, I'm careful, count my carbohydrates. I don't crave sweets like I used to. I used to love chicken. I could eat a whole chicken. Now I don't even eat a leg. I don't have the desire like I did.
So this combination of restriction, a little bit of malabsorption, and the lack of desire helps our gastric bypass patients lose weight very rapidly, very aggressively, and very, very successfully. The hospital stay is typically only 2 nights. Most people that come in, for example, on a Monday will go home easily by Wednesday. And we talk about average weight loss is about 10 to 15 pounds every month towards reaching a goal. The second operation that we do is called a sleeve gastrectomy. And a sleeve is an operation where we make a vertical cut line up along the stomach. We exclude and actually remove a large portion of the stomach. So we're not actually putting in a sleeve, but we're creating what's left of the stomach that looks like a sleeve. So it's relatively long, it's thin, and it's relatively resistive. And what that means is the same as a gastric bypass, where a small amount of food is going to come in and make you feel comfortable. With a sleeve, a very small meal is going to make you feel comfortable. A small breakfast, a small lunch, and a small dinner, and nothing else all day but some liquids between meals and complete comfort.
I love food. The difference now is that the quantities are so different. You know, I can have a couple bites of something and be totally satisfied. Whereas before, the quantities, I had to have more. You know, I didn't know where to stop. At the beginning, it's different for people. It's different. They almost feel like, how am I gonna live if I can only eat a couple bites of this or a couple bites of that? But your body starts to adjust, and then it's almost like you become like normal, where you're able to eat normal foods but a smaller quantity. It's great to be in control with the things that I know will alter the course of my life. And after doing my own research, I felt most comfortable with the vertical sleeve gastrectomy.
The major difference between these operations and medical weight loss programs that really don't work all that well is that these operations are going to keep you completely comfortable while still eating less than 1,000 calories a day. And with a sleeve, we get some of the same benefits, that those hormones that drive our hunger go away and stay away. The weight loss with a sleeve comes very similar to a bypass, 10 to 15 pounds a month. Most of the weight is lost in the first year and a half. The difference with a sleeve is we're not rearranging the intestine. We don't create that malabsorption. So it's purely restriction and comfort with eating.
When I decided to have weight loss surgery, my #1 goal was to get healthy. It wasn't to get down to a certain size or a number. It was about being healthy and being the best me that I could be. Initially, people think it's for you to be able to get in that smaller size jeans, but it wasn't for me. I mean, that's a side effect, but for me, It was about my kids, and it's about being the healthiest mom I can be, because I want to be a role model for them. I want to be able to jump in the car and like go to the park and like just go run. Let's get out there, let's be healthy, let's enjoy this amazing life that we have. And I couldn't do that at 243 pounds. For me, I look in the mirror now and I feel it's great and it's surreal. And I don't think, unless you've battled weight loss, I don't think people understand, but people that have battled with being overweight most of their life, you can't even understand what it's like to sit in a chair and be comfortable and cross your legs.
The last operation we talk about is a laparoscopic adjustable gastric band. And a band is a silicone ring that we put around the top portion of the stomach. And what we're doing is we're creating the appearance of almost like an hourglass, where the sands get caught on top, you get that deep waist, and things trickle through. The band creates an obstruction at the top portion of the stomach. So as you eat, food comes into that small pouch, a pouch very much like a bypass, a small pouch above the band, and as that pouch is full, you feel satisfied. Again, being able to eat a very small breakfast. We're talking about 1 egg, a little bit of Greek yogurt, and that's enough to keep you comfortable all morning long. Slowly, the food will trickle through the band into the rest of the stomach, and digestion occurs normally downstream. We're not changing or rearranging anything.
When you go to the nutritionist, it gives you an idea of what kind of foods you should eat, what you should not eat, what your portion sizes are. That's a good thing because, you see the huge portion. Now you can't eat that huge portion. So you start there. And the best thing, if you start before you have the surgery, when you have the surgery, the rest of the journey becomes a little bit easier because you start to wrap your brain around exactly what you're doing.
The band is a balloon. It has a balloon on the inside, and that balloon's attached to a tubing and then a little port that we bury underneath the skin and the fatty tissue on the belly wall. And with that port, we can add fluid to the band or take fluid out of the band. A simple procedure we do in the office that takes all of about 2 minutes to do, and we can tighten the band or we can loosen the band depending on your needs. So the band is nice because it gives us that ability to adjust or change the restriction for the rest of your life.
I'm going to do this for the rest of my life. And I have to make the change, not a 5-minute change, not a 2-year change, but a lifelong change.
We could put fluid in when you're not losing weight appropriately or don't feel enough tightness, or we can take fluid out when there may or may not be an issue. And that adjustability is very nice and it's very unique to the band.
The best option for me was the lap band in my situation due to the fact that I take the Coumadin. And only because there's little small cuts, minimal bleeding, no cutting, nothing major that I have to deal with.
Adjustments and fills are necessary. We see our patients very frequently. A band patient can be seen once a month, every month in the first year. And that kind of very diligent follow-up helps our patients do exceptionally well. Now, you need to know with a band that weight loss comes a little bit slower over time. And while most band patients that are doing the right thing will catch up and get the same weight loss long term, the weight loss usually occurs over about 3 years as opposed to over a year to year and a half with a sleeve gastrectomy or a gastric bypass.
My weight was just blooming out of control. 327 pounds, that's my top weight. I have lost 150 pounds.
A good number of our band patients are done as outpatients, meaning you don't even have to stay in the hospital overnight. You have the surgery and go home the same day.
Went in that morning, they did the surgery. After the surgery, I came home, after recovery, I came home. Within 2 days, I was back to myself. I was good.
After surgery, getting back to normal life and normal activities, most of our band patients are back to doing most normal things within about a week. When we talk about a sleeve or a bypass, it's usually about 2 weeks getting back to normal activities, back to exercising, back to work, and back to school, because with the rapid weight loss with those two operations, there's a little fatigue that goes along with the initial post-operative period. Now, I mentioned that bands can be done in 2 different ways. That's a very classic band I just talked about. One of the newer things we're doing with bands is called a banded plication, and that's one thing that's very unique about our program. I don't think there's anybody else in the area that's doing plication. It's a procedure that was described by a group up at Duke University. We have a very good number of patients that have had this procedure that do very well with it. And what this entails is putting a band in the way you would classically place a band, and then you would free up what we call the greater curvature of the stomach and allow some mobility so that you can fold that part of the stomach in on itself. You don't cut it or remove it, so you maintain the safety of the band, but you fold it in and place sutures to hold that portion in place. And that's called plicating the stomach. So you create better restriction below the level of the band. And that plication will give some of the same benefits as a sleeve or a bypass. We get some of the same hormonal change where the desire goes away after surgery, where you don't have that same drive to eat. Now, I do believe the plication is not going to last forever. It will stretch out to some degree, but that's the reason to have the band with it. The plication will help the weight come off a little quicker at the beginning. The band will help maintain that weight loss for the rest of your life. So this is an option for anybody that's interested in a band and possibly having a plication with their band. So these are the different operations that we do for weight loss surgery. We've had very good success with all of the operations. There's not just one operation that's being done out there. And because there are 3 very common operations, it goes to speak that there's different ways of losing weight. And I do believe that any one individual can have very good success with any of these procedures. The choice of the procedure is up to you. Will help you make that right decision for yourself. So I want to talk a little bit about what to expect after these operations. With a band, it's very important that you recognize the follow-up is one of the most important parts. Putting in a band is a very safe and usually straightforward operation. The success that we have in bands is based on the follow-up that we do with them. So I mentioned that bands are typically seen in the office once a month, every month in that first year. We do a lot of frequent follow-up, and with that very diligent follow-up, our band patients do very well. Sleeves and bypasses can't have adjustments to the operations we do. They don't need to be followed as closely as that, but we still see our patients quite frequently in the office. Most of our band patients will go home the same day as their operation. They're done as an outpatient. Bypasses are typically 2 nights in the hospital, and sleeves typically stay in the hospital for 1 night. The follow-up is pretty regimented at the initial part. We'll see everybody within about a week to 10 days of their operation to make sure everything is going well. We see everybody within 3 to 4 weeks of their operation to make sure they're transitioning nicely on the diet and getting back to normal life. And from there, things differ a little bit between bypass and sleeve and bands. Bands I mentioned, sleeves and bypasses we still follow very frequently. We typically will do every 2 to 3 months in the first year, and more frequently if necessary, although that's not all that common. Getting back to normal life, normal activities, school and work, most of our band patients need no more than 3 to 5 days to be back to themselves, and we'll tell most people within a week, almost 100% of people are back to doing 100% of what they want. I mean, with bypasses and sleeves, typically we're talking about 2-week period of getting back to normal activities, normal life like work and school, because at the beginning of a bypass or a sleeve, most patients are losing weight very rapidly, and there's a little bit of fatigue that goes along with that. Really, the primary goal for us as a bariatric program is not so much the improvement in the appearance, and that's certainly the icing on the cake, as we like to put it, pardon the pun, but it's the resolution of the medical problems that go along with excess weight.
My health now is fantastic. It's my cholesterol's dropped, my triglycerides have dropped. Everything that was supposed to drop, dropped, and everything that was supposed to go up, went up. All of my health gains, I feel, are attributed from the surgery.
I think my future is so much brighter because I know that by eliminating the excess weight, I'm not going to have issues, health issues that I knew were just around the corner if I didn't take control now. Because, you know, we're all getting older, and as you get older, you know, your health starts to decline. And so there's so many things in life that we can't control that I'm thrilled that I was able to kind of take control of something that I can control. I can control my weight.
We find that greater than 90% of our diabetic patients will have significant improvement, if not resolution, of their diabetes. High blood pressure can be as much as 75% of patients. Sleep apnea, also 75% of patients, no more sleep machines, doing well. High cholesterol, reflux disease are really kind of cured with these operations. So the long-term medical issues that go along with excess weight really do go away with these operations.
I have a pulmonologist. I'm on Coumadin. I had asthma. I was in intensive care for a week and a half. My heart doctor said my weight gain. It was the weight gain. Get rid of some of the weight. You'll lose the diabetes. You'll lose the high blood pressure, and you'll be a much healthier person. But you need to lose the weight because you're killing yourself. I know I didn't want to die, and that was my fear. I was going to die. I used to could not run up and down the stairs. As an asthmatic, I can run up and down the stairs now without getting out of breath. Since the surgery, I take a lot less medication, a lot. That's a wonderful thing.
When we look at most conservative medical weight loss programs. They really don't work long term, and when we look at the majority of the studies, they'll show us that greater than 90% of patients will gain weight back over time with these programs if they're able to lose it at all.
So I tried everything and nothing worked. You lose the weight, but then you gained it right back.
And I would lose weight and I would gain it back and lose weight. Had always thought about weight loss surgery.
You know, you try them all and you're like, okay, I'm not getting anywhere, I'm not getting anywhere.
That goes to speak against the vast majority of weight loss surgery patients that will lose weight successfully and get down to their goal weights. The weight number, the way things look at the end of the day, that's all a personal thing, and I think you'll find that everybody is very happy with their overall results. One of the most dramatic things to me about weight loss surgery, and one of the reasons that I do it, comes from a few of the patients that we've operated on and followed them through the years as they've lost their weight. And they talk about themselves in almost as two different people, the old and the new, and how this new person knows how to do things, does it right, got a new lease on life per se, and is not going to make some of the same mistakes. So the enjoyment for us is really watching people change their lives, and I think you'll find we're part of the family, we're part of the program that'll help you get through this and have the successful result that you're looking for.
I wouldn't hesitate and have it done the procedure. I would go ahead and do it.
Having the surgery was the best thing I've ever done. I couldn't have done anything better. That was the best thing I could have ever done in my life.
For anyone who's battled being overweight most of their life, I would just say that take the step. It's the one time in your life that you can make a difference. There's an amazing world that lies ahead if you just take the one step.